I'm Dr. Richard D'Amico. I'm a plastic surgeon and a Medality Medical board member. I'm happy to be with you today to moderate the surgical video presentation of the Medality Medical MVL HydraSolve technology. This is a technology that uses tissue liquefaction using a warm stream of pulsed water to remove selective fat. Today we're going to see it used to perform mesenteric visceral lipectomy, where the internal abdominal visceral fat will be removed in an attempt to mitigate or even cure type 2 diabetes. I'm with Dr. Richard Peterson, who is the Chief of Bariatric and Metabolic Surgery here at UT Health. Dr. Peterson was a pioneer in this MVL work, having done the baboon surgery that allowed us to go into the human pilot study, which we're in the middle of now. Today we're going to see patients who are in the middle of that pilot study, patients 6 and 7, where mesenteric visceral lipectomy will be performed with the Medality Medical HydraSolve technology. Dr. Peterson, tell us the anatomy here that we're going to see, and tell us what the difference between visceral fat and the kind of fat under our skin. What is that about?
So we have a couple of illustrations here, and if you see like this side view here of a person, this fat that we're looking at, there's two types. This is that subcutaneous fat that you were kind of asking. So there's different types, and I'm glad we've highlighted them in different colors because the yellow is the area we're working in. This fat here, the mesenteric fat, we're actually going to be going after that using the HydraSolve device today. And that's where we're seeing this fat seems to be more metabolically active, meaning that there's something that when food or things are coming in that triggers that fat and triggers a response.
This has never been done before in human beings.
That's correct.
Why is that, and what is it about this new technology that's made it possible?
This technology, it's quite gentle in the way it works. And so it has made getting into what is a very fine amount of fat, it's a very safe technique to get into it. And I'll show in a minute as we get into what the blood vessels look like, because that's the concern.
The concern is that you're going to harm the blood vessels?
The concern is, well, there's so many, right? And so if you're not using something that's gentle, you can definitely injure them. And so this technology has definitely been something that we see is much easier and gentler on the vessels. You'll see actually in the surgery itself, we call these arcades. You see they're sort of loops. And so there's lots of little ones. And this particular device, as I'm using as a pointer as well, is the HydraSolve cannula device that we use. This actually allows us to go into these areas here and really extract the fat without injuring or hurting any of these vessels. So it's very safe in that respect.
I'm in it now.
Yeah, you see that clears it up as it goes. It makes it translucent as the fat is extracted. You see through there, you go from there to something like that.
And you're using sort of a sweeping or windshield
We are,
wiper
and we're keeping the aperture of the cannula at the 12 o'clock we kind of range it between 12 o'clock and maybe as much as 10 and 2, right? We don't really want to turn it upside down at 6 o'clock because the vessels and things like that are there.
So you can see the vessels here. This is the arcade that we were talking about on the picture before. Larger vessels here, you can see they're all intact, not disrupted. This area here is where all the fat extractions already occurred on both sides. So, and you can see these blood vessels running up to the small bowel. That's what's feeding all of it to keep it healthy and alive. And this is these areas here where we really extracted the majority of the visceral fat.
Do you know any other technology that you would even consider using in this situation?
No.
None.
So this is the first of its kind. This is truly the only metabolic surgery of its kind. The other ones, when the other world, the bariatric surgery world, weight loss world, that is weight loss and treating metabolic syndrome that's associated with that level of obesity. Here, we're looking at people who have a very small level of obesity, but have all the other factors.
All the really risky things.
Right, and so those folks are, unfortunately, they're not even candidates for the other surgery because they don't qualify based on their BMI. It's too low.
Right.
And that's why this particular technology, this surgery, is going to fill in a gap for those individuals who are suffering from type 2 diabetes, high blood pressure, and cholesterol.
And so the potential here, because the longer you're pre-diabetic and diabetic, the worse it is. So this maybe allows us to get these people a little bit earlier in the disease process.
That would be the hope, exactly right.
I'm here with Dr. Jason Kempenich, who is Program Director of the Surgery Program here at UT Health. Dr. Kempenich, as a bariatric surgeon, how has the mesenteric visceral lipectomy opportunity, how has that allowed you to intervene in diabetic patients?
I think the huge advantage, typically diabetes now is really treated with medications, or if you gain enough weight, so you have to gain enough weight,
A lot of weight.
and then there's some very good operations that help you lose weight and also have a significant impact on diabetes. And so with this operation, you can intervene much, much, much earlier. Patients can come off medications. They can be more sensitive to their insulin.
So if I understand you, we can intervene perhaps earlier in the diabetic process, knowing that the longer the diabetes is there, the more trouble the patient's going to have.
Yeah, earlier intervention, you don't have to wait for the patient to gain a whole lot of extra fat tissue. You can remove this mesenteric fat and their diabetes will improve significantly, preserving their pancreas and beta cell function.
I'm here with Dr. Ralph DeFronzo, who's Professor of Medicine and Chief of the Endocrine Diabetes Service at UT Health. Dr. DeFronzo has authored more than 800 papers, and he's a world-renowned diabetologist and the principal investigator in the pilot study that Medality Medical is doing on mesenteric visceral lipectomy, with the goal of improving or curing type 2 diabetes. Dr. DeFronzo, tell us about insulin resistance. What is that? Why is it important?
Yeah. So I think I'll sort of kind of back up a little bit and sort of set the stage for what is diabetes. Okay. So in its simplest terms, there are two major problems. One of the problems is what you just referred to, and that's insulin resistance. And basically that means that the tissues in the body, the liver, the muscle, the adipose tissue, don't respond normally to insulin. And if you don't respond normally to insulin, there needs to be a compensation. And the compensation is by your pancreatic beta cells. They recognize how insulin resistant you are, and they'll secrete enough insulin to offset the insulin resistance. And as long as your beta cells remain healthy, you won't develop diabetes. But unfortunately, diabetes is a progressive disease. The insulin resistance is present very early, and now your beta cells start to fail. And as your beta cells start to fail, they no longer secrete enough insulin to offset the insulin resistance, and so you develop type 2 diabetes. Even if you don't develop diabetes, if you're insulin resistant, this is going to predispose to the development of coronary artery disease, that's heart attacks, carotid disease, that's strokes. And then if now your beta cells fail, now your glucose goes up. Now you have another problem. You have all of the problems that go with high glucose. And what are those problems? Those are blindness, diabetes being the commonest cause of blindness in the United States. You develop kidney disease and neuropathy that leads to peripheral vascular disease and amputations.
So tell me about the mesenteric visceral fat. What's bad about it? Why do we want to take it out? And what do we hope to accomplish?
Yeah. So let me just take one step back and to kind of put the visceral fat into perspective of total body fat. So in the United States, it's about 62% of adults over the age of 50 are considered to be either overweight or obese.
So that would be a BMI over 30?
Well, overweight means sort of 27 and a half, and then obesity is above 30. And when you become obese, your tissues become very resistant to insulin. So obesity is the worst thing that can happen for someone with type 2 diabetes. In general, people are fat who have diabetes, about, say, 90% of my patients. And that's pretty much true throughout the world. Now, amongst the fat depots, there are certain fat depots that really have a more ominous prognostic implication than others. So in particular, as you mentioned, the visceral fat. So what is the visceral fat? That's the fat that's within the intra-abdominal cavity. So we have many, many studies that have shown that this visceral fat produces a number of cytokines and cytokines that cause inflammation, but the visceral fat is particularly bad.
Particularly bad.
And-
And that's why we're going after it.
Yes.
With this technology.
Yes.
This Medality medical technology that can get in there safely and get this out.
Yeah.
Great.
And we did a study in baboons. So baboons are very similar to humans. And baboons living in the wild don't get fat. But when you put them into captivity, you see they gain weight, and their genetic background is very much like humans. So the baboon is a really good model to look at in terms of obesity and diabetes. And we've done studies in baboons showing that if you remove a visceral fat, you can markedly improve the insulin resistance, and you can improve their glucose tolerance. So we have a
Do
good,
they become insulin sensitive? Is that where we want to go?
yeah. Now, it's impossible to get rid of all of the insulin resistance because there's a genetic component, and there's still a lot of fat even after you remove the visceral fat. But that visceral fat is contributing in a disproportionate way to the insulin resistance. So that's the fat we want. I mean, ideally, we got to get rid of all the fat in the body, all right? But that's not so easy to do. And from the surgical standpoint, of course, you can't do that. But now with the new technology that Medality has developed, we can go in and we can specifically remove up to 70 to 80% of that visceral fat. And again, the results are early on, but they're encouraging that we are seeing an improvement in insulin sensitivity, meaning the insulin resistance is getting better, and we are seeing the A1C decline, and the A1C is what gives us a measure of your overall glucose control. So the initial results that we're seeing, although we're early in the sort of early stages of this technology, they look quite encouraging.